Well, thank you, Mr. President. I want to talk about a couple things today, a little bit different than I've spoken about before. Since early March, we've really been focusing on two key concepts for testing. Number one, to assure and expand supplies in the U.S. market. This is really critical because we were talking about really a cottage industry with very minimal suppliers that we were asking to supply over a 2-week period of time the normal production that would be for at least a year. And as simple as a swab is not a swab is not a swab. And we need to be very careful that when we put something in a person and tell them a test result, that it's really correct. The second component is to secure sufficient supplies at FEMA during this time of peak disease, where we could alleviate any maldistributions within the state. This is the FEMA process of requesting and sending things out and also supporting outbreaks. So starting in my office many weeks ago, we assembled a multidisciplinary team of really incredible people. The medical side of the equation, which I represent, the laboratory side of the equation, high-tech side of the equation, logistics and operation. And Brad Smith is his day job as director of the Center for Medicare and Medicaid Services, an incredibly important component of our country's CMS system, building the future healthcare system, but has done a really incredible job operationally and logistically in bringing everyone together. We have focused on every piece of the supply chain that relates to testing, down to the most minute detail, and he's going to talk to you about some of that. But that started in the second week of March with starting an airlift, because the only supplier, the main supplier of swabs at that time, was a place in Italy that was completely shut off because of the outbreak in Italy. So Admiral Polubchak arranged Greytail Air Force planes to go to Italy to bring millions of swabs back to secure. That's just how it started, and it's expanded since then. The second part is we've been really marrying, and this has been the beauty, the logistics and supplies to the overall strategy. Two pieces of strategy. Number one, what is the overall testing strategy? And Dr. Birx has had just an elegant strategy in the past, but even more important in the future, when we make sure we take care of indigent populations and those most vulnerable. So the clinical, the contact tracing, and the monitoring of those who are at most risk. We've also married it to the strategy, and you've heard more than you wanted to know about it, that a small machine that's point of care is good for certain things, but it's not going to test 5,000 people over a short period of time. So the small machines, the medium machines, and the large machines, and how to contextualize them. And the third thing, before I give it to Brad, which is very important, and it's really critical, is coordinating the research, the epidemiology, and the FDA regulatory process. And why is that so important? When we started 5 weeks ago, if we wanted to test this many people with the technology we had, we would have used about 80% of the strategic national stockpile in PPE just to do testing. We needed an innovation. That innovation was to be able to test out of the anterior nose with a completely different kind of swab. It sounds very mundane, but if you don't do that, you can't get the testing to scale. That allowed us to really go to widespread testing. Last week, moving to polyester swabs, which is going to open up millions of new swabs onto the market. But that's a regulatory science and innovation step that had to co-occur with this. And with that, I'm going to let Brad talk about some of the details that he has really shepherded over the past weeks in ways that have truly been amazing and incredibly impressive to me.